There's no fault in a three-legged dog. They can get around and they can do awesome things. But what we do know now from research is that there is even more awesome possibilities when you have some version of 3.5 legs and a prosthetic.
Find out how prosthetics can help tripods and why it's important to consider them before surgery from Orthopets founder Martin Kauffman on this episode of Tripawd Talk Radio. Hello, and thank you for tuning in to Tripawd Talk Radio or watching on the Tripawds YouTube channel. Today we have a special treat for anyone interested in prosthetics for pets. This is episode number 112, and it is part one of a two-part series where we'll be talking with the founder of Orthopets, the leader in developing custom orthotics and prosthetics for animals, and one of their recent rear limb canine prosthetic customers. Martin Kauffman founded Orthopets in 2004 with the simple mission to improve mobility for animals. You can learn much more at orthopets.com. We first interviewed Martin in 2013. The industry has evolved quite a bit since then, and Orthopets is now the largest, most respected provider of veterinary, orthotic, and prosthetic solutions for animals. We'll also hear from Tara Eichenberger about her Tripawd Boris. Prosthetics are often the first thing new Tripawds members ask about, so we're excited to get started. Welcome to the show, both of you.
Hi.
Great pleasure to be here.
Hi, Martin. It's great to be here. Let's just jump right in because we have a lot of catching up to do. Martin, we're going to start with you. Just for the people out there who maybe have been living in a cave and don't know who Orthopets is, can you just give us a brief overview of Orthopets? I mean, everybody cites you guys as like one of the leaders in the industry. You are. And I'd like everybody to know what makes Orthopets stand out from others.
Yeah, we're just a collection of people here in the United States, in Denver, Colorado, and Helsinki, Finland, actually. We're a collection of people who have a common mission, and that is to bring all of our knowledge and skill in engineering and healthcare from human and veterinary sciences to improve the quality of life for our animal friends, and then by extension, the pet parents. And that's the common mission, but what really is near and dear to our hearts is how we mix technology with just the practical, everyday. These things have to be really helpful and functional for our pet parents and our pets to use. So it's that common purpose that drives us. And we can talk about all the fun technology and 3D things and, all the gadgets and gizmos. But really, the essence is the collection of us with that common drive.
I love that. And I have to say that you were the first person who really enlightened Jim and I on how much a prosthetic can improve a tripod's quality of life.
You said something really enlightening to me back then, and that was that tripods are awesome, but they can be more awesome with the use of prosthetics and orthotic devices. And another thing you said was save the flipper. So those animals that are born with deformities, why go ahead and amputate it all? Let's go ahead and use what they have and adapt it and make them better.
Yeah, there's so many tones to that statement, but I would just simply affirm what you said. There's no fault in a three-legged dog. They can get around and they can do awesome things. But what we do know now from research is that there is even more awesome possibilities when you have some version of 3.5 legs and a prosthetic.
I like that, 3.5 legs. It's so true because since we last talked to you, we have raised a tripod from 8 months to 12 years. And what we saw over the course of those 12 years was how much being on 3 legs affected him. And we knew that had he had the opportunity to have a prosthetic, it would have made all the difference in his quality of life.
So Renee's talking about Wyatt, who at 8 months old had a lower rear limb injury that, they could have saved that knee. There could have been a lot of residual limb there. However, they took the whole leg.
Yeah. And just to that point, and the essence that we have as a company is we manufacture, and absolutely that's the core of what we do, but we also educate and we train. And part of the new things that we've been doing since we spoke last 9 years ago, developing curriculum, we're in the textbooks, we're in the university level where we're talking about limb preservation and for a purpose. And why would you even think about doing that? And one interesting little side piece here about what we're up to now, our mission now is to reduce the bandages that are tourniquet and cause these really bad outcomes like limb amputation. We want to reduce that to zero. We want to reduce the complications associated with casts and bandages that end up with amputation. And that's a really new core focus for us.
Well, thank you so much about the education, because that's what we're all about, helping people understand, because too many times people come to Tripawds after a full amputation and their first question is, can I get a prosthetic for my dog? So let's get on with that discussion.
Well, and just real quick, we have seen a lot of members come to us after a wound care for some type of limb procedure. That wound has gone bad and they needed to amputate. So right on with that, because I would love to see that avoided. We don't like it when people join the community. We're glad they found us, but for the reasons that they join us, it's really tragic. And so much of it can be prevented with education. So Thank you so much. We'd love to hear about some of the other developments that are happening. Like we'll talk about Tara's experience in a bit, but what can you tell us about what's changed? I mean, 3D printing, we last talked about that. Can you enlighten us about these developments?
Yeah, so there's basically two things for us to discuss. One is about how do we shape and make the models that we're going to be using. So that's now all in the digital space. So we're using scanners to acquire the limb shape. We're using computer programs that are like a CAD program that we're sculpting the shape of these legs, and we're making corrections to the alignment of these legs. But we're doing that with the ability to predict pressure and forces. So we're already taking away some of the challenges that are inherent in wearing devices that are outside the body, because we can predict more of that than we could in the past. And we get to do that faster. So that helps reduce the time where our pets have to be without. And that could be prosthetics or orthotics. So those digital things, the tools that we have available now, make it easier for everybody when they're working through these really complex cases. And then beyond that, now we're moving into the material sciences. And how do we equip our veterinarians to have things on site that are so much easier for them in that casting and splinting world, so that we can, again, focus directly on those problems associated to that topic, where you're getting into a cast. And we would like to see that our currently 18% of our prosthetics are because of cast problems. It's usually vascular, it's the tourniquet. So like you said, I don't like when people have to join your group because of the lost leg. I'd like to see 18% less prosthetics in my group because we don't have those problems.
So real quick, you mentioned something really important there, and you said veterinarians. So Orthopets works directly with veterinarians, not directly with the customer. Could you kind of address the importance of the DIY route versus working with someone who develops a custom prosthetic? There's off-the-shelf devices out there that people tend to buy. We've been approached by schools and kids are doing projects, and 3D printers say they can do it. Why is it important to visit, your veterinarian or a board certified surgeon and work with Orthopets or someone who makes a custom device?
Well, I think it's there's a lot of layers to this, but first and foremost, it's respect for our patient. Someone is entrusting us to care for their patient who knows some of the barriers and problems that you're about to face, so you don't go into it blind. So out of respect for the outcome, where the mission is to improve quality of life, then it makes sense that the team that's supporting you is bringing their knowledge and expertise, so you don't end up causing a whole new set of problems. And I think that really becomes the foundation. I love DIY and I do it myself, but the clinical expertise, we've been doing this now almost 20 years, and we've treated over 30,000 animal friends.
Wow.
Of all species. That's not just dogs.
Mm-hmm.
But the point is, we've already been there and we've done that, and we've already researched it. So the most important thing would be to say, respect for the outcome. So when you come in with a question or a case, you can get a direct answer. So everybody's decision-making process is more clear and more objective.
And avoid those complications that occur when you don't have the understanding of body mechanics. And
let's use a really simple one. We're talking tripods, but missing both front legs. Great, terrible example here that just tugs on a heartstring. Making little wheelchairs for small dogs without front legs. I've seen these things online where there's two little wheels out in front. And we've been contacted because dogs have been using these things. They tip forward and they break their neck.
Oh.
And now we're making neck braces or paraplegic style devices. So it's these kinds of things where you don't know the problems that you're setting up the patient for, just because you don't have the expertise and the training and the education to know that you're causing a significant problem.
That's a huge problem. And one thing you mentioned about the materials and things that reduce the complication rate. Pets can't tell us when the prosthetic is rubbing in the wrong place or when it hurts. And with humans, a human can go back to their prosthetist dozens of times to get the right fit because they're vocalizing how it feels and where it's rubbing. But for animals, up until these new materials have been developed, has it always been just kind of a waiting game to see where a pressure sore developed?
Well, like our friend here who's on our discussion today, the materials that we use on the inside are very similar to the materials we use for our human diabetic patients. So I agree, humans can vocalize and they can tell us when a problem is occurring because they feel it, but our diabetic friends can't. They can't feel because of their peripheral neuropathy, their nerve loss. So we use specialized materials that create a discoloration that tell you, look here, there may be a problem. Now I can look there and look at my own leg to see if there is a problem developing. So what we're really saying is we want to empower pet parents and veterinarians to be able to use their simple assessment of there's something discolored here on my foam padding. I look to that area on the leg to see if there actually is a complication. No different than your long second toe in your sandals, and you look down at your flip-flop and you wonder, am I getting a blister right there? Because I can see the pressure.
That yeah, we're runners. We can totally relate to that scenario with running shoes. That is really cool. So the pet parent has some involvement there, more so than in the past, in being able to decipher where the issues might be developing.
Yeah, because being a pet parent and being what I love about prosthetics and orthotics is that we're empowering pet parents to be the first line of healthcare. They are the ones who are putting this on. It's not like the surgeon, one surgery and I'll see you in 8 weeks. Just like our friends here today, someone is applying the prosthetic every single day. They're the first line. They're 90%. They're 95% of the outcome.
Yeah, and Tara will be able to tell us a little bit about that in just a bit. But tell us, Martin, has the ideal candidate changed now that the materials are new and more advanced?
Right. So this is still back to, well, as I like to joke in my office, it's thermodynamics and it's lever arms. So I don't have a lot of shifting on gravitational forces here on this planet. I know Elon Musk is going to Mars, so maybe it's going to be different there. What I'm getting at is there is this ratio that we work with. How much limb is present? That's a length of lever arm that can control something underneath it. So we look at this length and the segments of the anatomical retained limb compared to how much length is underneath. And that's the prosthetic. And near and dear to our hearts, and for this discussion, the shorter these legs are electively amputated. And that's what we're talking about, rather than osteosarcoma and the whole leg does need to come off, absolutely. But when we have an elective approach, when we can decide how much of the functional leg is being removed, so those have not changed. These lengths of mid forearm and then we'll call it the shin. We're familiar with that when you've kicked the back of a trailer hitch, your shin. But that mid tibia, mid radius, so that 40 to 50% retaining of that limb segment still is about the top end where you can have a functional prosthetic. Let's go back to technology and what we see as industry leaders. We see a lot of pictures online of these like front leg amputees, and there's a body vest and there's this big peg bolted to it with a little rounded bottom. It looks really good on a picture, but if you ever see a patient attempting to lay down daily life and then get back up, we end up seeing that it actually made life harder. And it took away the freedom of that patient. So we're into these problems here of what are we trying to accomplish, and can we?
I'm glad you mentioned that, because I've seen that device and I've often wondered how that device works going up and down stairs. It might hinder that action. And this brings up the importance of consulting about prosthetics, if you have the pleasure of doing so, before surgery, and getting as much residual limb as possible.
Yeah, we've got our educational components that Dr. Felix Dewar and I, he's an orthopedic surgeon. You're familiar with Dr. Dewar. He and I have created content for surgeons on technique and considerations, but as you've just said, the contraindication, when not to talk about it. The way I like to phrase it is, I'd prefer not to put a handcuff and imprison one of our patients because of a prosthesis that is not functional. I would not want to do that to myself or to any pet that I'm have the honor and to give the respect to give motion to.
Mm-hmm. And so what you're saying is, like, for a full limb amputee, that dog's all the way, legs gone up to the scapula. And so you're saying that they're better off without one, if that's the only thing that's out right now.
Correct. Yeah. And then we look to the other legs, and how do we support in a sports brace model? How do we support the abnormal forces that now are being directed to a leg that was never built to handle it?
So is there no hope, or is there any sort of studies or plans or thoughts or designs and development for the full limb amputee, whether front or rear? There's talk of, putting a wheel on the rear leg, and, I would presume they'll have to have some kind of shock absorber. These things are really more braces if you're standing still, but in motion. So is there anything potential in the pipeline?
Absolutely. Now, this is actually a fun talk. Over 6 years ago, so at Colorado State University, biomedical and engineering and electrical engineering departments collectively, we all started an initiative, and it started with the paralyzed back leg patient, where we're developing sensors and motorized exoframe skeletons that walk the dog because of what the dog is thinking and doing. So we're developing an algorithm right now of what back legs and front legs are doing in space based on what the dog wants to do. What that means for us in this tripod community is that we're developing a body of evidence that says, can we make a smart prosthetic that attaches to the body that has all of these joints that now move through, we could call it robotics, mechanized prosthetics, where the whole leg is moving just because of what we're thinking and what the rest of the body is doing. So it's on the horizon. Now, we don't have a time frame on it, but we're 6 years in and we're making good progress.
That's really fascinating. We look forward to following that, because I've seen human prosthetic development where hands can actually grasp simply from motosensors and that sort of thing. So we look forward to.
Yeah, you get chills when you think about what's happening and where this is going.
Yeah, definitely. And is a lot of this technology coming over from the human side?
It's both. What's interesting for us is because of the honesty and the drive of our animal patients and their willingness to just go for it every single day and not ever stop, we're also seeing that we can get a lot of research done in a meaningful way from our animal friends to bring it back to our human friends. And it's not to say that us humans don't have the drive and motivation, not saying that. But if you've ever seen a pet doing a thing they do every single day, maybe we have a higher bar to hold ourselves to.
Definitely. We always try to be more dog, as we like to say around here. Yeah, I want to touch real quick on what you mentioned about supporting the other limbs when a prosthetic isn't an option, because our Wyatt, he was a rear leg amputee, was a German Shepherd, low back end. He had horrific arthritis in his tarsus by the time he passed, and we had to let him go because of the osteoarthritis. It was just so bad. What can be done early on in an animal's life when a prosthetic isn't an option, as far as the devices that you create?
Yeah. So the focus that we have is preserving normal motion. And what we're really saying there is, with sports bracing for the tarsus, carpus, and stifle, is to have a support system that's used for higher levels of activity, that has hinging and motion, but it's really there to absorb the abnormal forces that are presented to these single remaining limbs that are always positioned in areas and alignments that they were never designed to be in. So let the device handle the consequences of that, and allow the normal forces to persist. So you're like a barrier, you're like guardrails on a road. We're there so the abnormal doesn't happen, and then those catastrophes don't occur. The normal can persist.
The adjusted gait and stance and the additional pressure being put on those limbs is then compensated by these custom devices, because oftentimes people are buying off the shelf devices. And I get back to that conversation about, why is it important to not just go buy, a medium brace for my medium-sized dog?
Right, because there was a very specific presentation that your individual pet did. As we know, tripods, they will position their front legs in all kinds of different alignments based on their preference and their breed. So the medium doesn't handle your pet's problem in a way that means anything for you in the long term.
Every dog is different. All tripods are different. And this is why we encourage listeners to go see a certified practitioner who can do a proper evaluation, and the Tripawds Rehab Fund will pay for that first visit. So we can learn more at tripawds.org.
I was just going to pitch that. Yeah, we I don't know if you're aware, Martin, but the foundation will cover the consultation for any new tripod to go to a rehab practitioner, a certified provider, so that they can get evaluated. And my question to you is, for these orthotics, is this something that can be done early on in an animal's life, or should we wait until we see a problem?
Yeah, so like good running shoes, you don't wait until you have your plantar fasciitis or your heel spur or your Morton's neuroma, right? So we're thinking about sport braces. So it's not on all the time. Okay. But when we're going to go run and play ball, it's absolutely on. We want to not accumulate the problems until it has the tipping point. We'd prefer that there was no accumulation at all.
That is brilliant. We are currently on the search for our next tripod spokes dog, so we will definitely keep that in mind, because we didn't know this information with Wyatt. And I would just love to be able to prevent that issue. We get a lot of members coming to us because their dog has blown out a cruciate, and a cruciate repair, surgery, recovery on a tripod is something I would never wish on anybody. Can these devices prevent that kind of thing from happening?
Right. So prevention versus stabilization as it's occurred. And what I'm really teasing out here, the veterinary community is coming up with some pretty good research that's questioning if the cruciate injury specifically has some kind of a disease component to it, where it's just a progressive thing that is occurring, where it's a little bit less like the football player incurring the injury because they got hit by the linebacker, where it becomes this other disease factor where it's on the horizon and it's just a question of when. So when we're using stifle braces for our tripod friends, we think of it as prophylactic. We'd really hope that it doesn't occur. But we also know that we might not be able to prevent the biological process inside from occurring. But if it does, we're still there to stabilize.
Interesting. I would love it if you could later on point us to some of those studies.
Yeah.
I'd love to read more on that topic. Now, for a dog like Boris, who has a rear limb prosthetic, Would the other leg need a stifle brace?
So that's a fantastic question. In Boris's case here, and just as a side comment, as we've been watching Boris now, Boris is doing the things that Boris does, and any other dog would do, going to and fro, getting treats, just kind of normal things. Now, for Boris, because we have 4 legs back and we see a great gait pattern, we wouldn't have this concern about right stifle problems, because we've got normal gait. So now Boris gets to do Boris. Boris gets to be normal again. So then we would really downplay some of these consequences, unlike if Boris had a full back leg amp. We're having a very different conversation.
So you reduce or eliminate the compensatory issues on those remaining limbs by getting that normal gait back with a custom orthotic or prosthetic device.
Exactly.
Yeah, I wanted to say I'm having a really good time watching Boris move around, and just seeing him, like, I just can't believe he's missing a leg, because his gait is so different. And, when a tripod is young and first starting, that hop, it's like, it's a champion. My dog is a hero. My dog has overcome and will persevere. But as they get older and that gait becomes more, honestly, it's more crippling looking, and it really hurt us to see Wyatt. His spine started to C-shape, and we could tell he was having a hard time getting around. So the more we can do to prevent that from happening, the better. I love what you're doing, Martin. And I just have to ask for the cat parents out there, is there any hope for cats and prosthetics?
Absolutely. And then for our friends who have sheep, goats, llamas, alpacas, horses, take your pick. But yes, to the cat friends, we approach them very differently, as they need different solutions. But yes, cats enjoy their 4 legs just like the rest of us.
That is really cool. So if you have a 3-legged cat, or a cat who may become a tripod, you definitely want to get that consultation in ahead of time before surgery. Now, we just have a couple of minutes left with Martin. We'll get to Tara and Boris in a minute, but I haven't had a chance to talk to you about that study that you did with CSU on the quality of life study that you did. Can you tell us a little bit more about that? It was the retrospective multi-center analysis of canine socket prosthesis for partial limbs. And we'll put a link to that in the show notes. But that was really enlightening. Can you tell us a little bit about that?
You bet. So we had really 2 outcomes that we wanted to demonstrate. One is just the impact that prosthetics make on the quality of life, and that's from the pet parent. Us clinicians, we can look at our data sets and our force plates, and we can offer you objective statements, but we wanted to hear from our pet parents. And so almost inclusive of all participants, there was a positive impact to the quality of life of the pet and the pet parent. The outliers to that, and the second thing that we wanted to really demonstrate, is these lengths of amputation, how much leg is left, to really help answer these questions. And we did report several of our cases where the limbs were just not what we would prefer to have. We knew that they were going to have some problems, and they did. So we were able to really offer some certainty. So when that initial consult happens, we can say with increased confidence, your case is going to go great, or this is going to be a dangerous case and very difficult. Perhaps it's not the best choice for you. So it was great. Really answering those questions.
And so that will help veterinarians and ortho surgeons give better information to their clients who are thinking about it, right?
Yeah, especially when you come into the ER and you have to make really big choices really quick under pressure. Yeah. To have a little beacon of light to say, this is going to be a great case, or wait a second. And having that level of certainty due to research, that makes a difference for us pet parents when we're forced into these choices.
Yeah, definitely. We love all the research that you guys are doing out there, and can't thank you enough for that.
And Martin, tell us, since you work with veterinarians, but you also communicate with pet parents, what is the process? How do people reach out? Would they ask their vet? Would they reach out to you? What is the process for those people who have the luxury of time to investigate prosthetics before amputation, or perhaps shortly after?
Yeah, so you can make any contact, email or phone to our nurses here. Our staff is all vet techs who are certified, who work in the field. So we can answer the big questions that pet parents really want to know about, but also we can communicate to their veterinarians to answer the questions that they need to know about. So it can start with us. They can go right to their vet to ask them to contact us so we can get the conversation started. It's whatever's easiest.
And I believe that's orthopets.com and at Orthopets everywhere online.
You got it.
Awesome. Thank you so much.
So stay tuned because we're going to be
don't go
talking with
anywhere.
Tara and Boris about prosthetics for pets. Thank you, Martin, so much for what you're doing. Please stay on the line and we'll have you chime in with our conversation with Tara. For more information about prosthetics and other orthotic devices for pets, visit orthopets.com. Stay tuned for Tripawd Talk Radio episode number 113 to meet Boris and find out how his custom rear limb prosthetic is helping him love life on 3 legs. And learn more at tripawds.com/tag/prosthetics.